Good evening, everyone. We would just like to say thank you for coming to our Sickle Cell Awareness Month webinar. My name is Kavina Miller. I am the CEO and founder of Canna Kavina. We wanted to do this webinar to bring awareness and knowledge for those who may be wondering what sickle cell is. If you have the trait, how can I know more? What can I do? How can I donate? How can I be involved? Awareness brings change, and we want to bring as much awareness and knowledge to the community as possible. Tonight, you'll be hearing from some doctors, some management liaisons, and also from our CMO and Executive Director, Nicole Bubb, aka Nikki, who also is a sickle cell survivor, and she is going to be our main speaker. So just make sure that you are commenting on the video while you are watching it. She can be answering your questions live. I'm going to be here live. So just make sure that you are engaged as possible. Be sure to share it. And I hope everyone receives as much information as possible from this webinar. Thank you and enjoy.
This is Dr. Richard Drachman from the Sickle Cell Center at Rutgers Medical Center talking about sickle cell disease. Sickle cell disease is a fairly common illness in the United States, found primarily in the African American population, where the red blood cells, which are the cells that carry oxygen, instead of being shaped roundish, are shaped like a sickle or a banana and have trouble getting to the bloodstream and cause a blockage of red cells. Because of this blockage, you can have problems that are acute, like a pain crisis, or chronic problems like damage to organs like kidneys and your liver. It is very important to be taken care of at a center where there are many patients like you and there's a lot of experience of sickle cell disease. There's been a lot of work in the last few years regarding sickle cell disease. In the past, the life of a patient with sickle cell disease was very devastating, and the quality of life was very poor because they spent so much time in the hospital. But I'm happy to report that with current medications and current treatments, most patients can be expected to lead much fuller lives than in the past and are rarely admitted to the hospital. We use drugs like hydroxyurea, which raise a type of hemoglobin called fetal hemoglobin and help decrease sickling. And there are now a number of newer drugs, including a drug called Oxbryta, which increases oxygen affinity, which is how well a cell holds onto oxygen, and as a result, raises the hemoglobin, which is the amount of red cells you have, and causes less sickling. And a drug called Adecfio, which interferes with pain crisis and is given as a monthly infusion, while the Oxbryta is given as a pill you take every day. Other treatments include transfusion, and there's a possibility of a cure with a bone marrow transplant for some patients, and gene therapy may be a reality in the next few years. Together with your physician, sickle cell disease is something which is manageable, and I urge everybody to look for more information about this disease and ways they can help.
Just going over what Dr. Drachman was speaking about with certain drugs that have been given to sickle cell patients that worked effectively. Hydroxyurea, a little bit how it works. You see that fetal hemoglobin and the WBC and platelets. Fetal hemoglobin, very stable, doesn't hemolyze and break down as easily as HBS. And then the WBC and platelets, very sticky cells and worsen VOCS. So the pros, the only med to make you live longer with sickle cell disease, the crisis is down, ACS is down, hemoglobin goes up, which is good, and the transfusions are down. So you don't have to have as many transfusions. The cons is that it needs to be taken daily for 2 to 3 months to notice an effect. Compliance can be an issue. It needs routine lab monitoring, and you cannot take it if you are pregnant, and it can also cause birth defects. So a little bit about the fetal hemoglobin. It is the main type of hemoglobin found in infants. So it's produced in early fetal development until between 6 to 12 months when production stops. So it helps carry oxygen across the placenta from the mom to the fetus. Why some newborns with sickle cell disease may lack symptoms early on in life is because of this. So also with the fetal hemoglobin, the hydroxia, it helps the productions, so it improves anemia. And then the VOCs and complications need to take every day to get maximum benefits. So in order for this to be effective, this particular drug has to be used every single day. So HFPH, which is hereditary persistent fetal hemoglobin, is a genetic mutation that prevents HbF production from turning off during infancy. So just to talk a little about the Oxbryta drug that Dr. Drachman referred to earlier, this is a little bit about how the drug works. So it causes oxygen to bind stronger to hemoglobin, and it stabilizes the hemoglobin, which is what we want it to do for sickle cell disease patients. The pros, as you can see, there is improvement noted within 2 to 4 weeks. It is good for patients who can't take the other drug, hydroxia. And some of the cons is that it can cause some diarrhea. You cannot take it while you are pregnant or breastfeeding. The study did not focus on sickle cell pain. So just like everyone knows, sickle cell causes extreme pain in patients. So this is a drug that has some cons with that. So a little bit about the last drug that Dr. Drachman was referring to. So this is a little bit about how it works. Pan-selectin blocker that slows down the stickiness of inflammatory cells, which stick to sickled cells, worsening the blockage within a vessel. So a lot of the pros is that there's a lower rate of days in the hospital, which is really great. 36% had no VOCs versus 17% receiving the placebo. It can be used with or without the hydroxia. Some of the cons is that you need a good IV access, so monthly infusion, and also you cannot take this while you are pregnant. So the reason why blood transfusions for patients with sickle cell is so important is because it dilutes the amount of sickle cells within the bloodstream, which provide healthy cells for the body to use. So you see what the blood flow looks like before the transfusion. So you see a lot of the sickle cells, and then after the transfusion, there are a lot of normal blood cells, which helps the patient with this disease, helps them with their daily activities, and you don't see as many sickled cells. So some people often ask, what is the difference between bone marrow transplant versus gene therapy? So we're going to talk a little bit about that. So bone marrow transplant replaces a patient's bone marrow with donor bone that produces normal hemoglobin. However, not everyone is a candidate for this since it's difficult to find a match. Gene therapy, which is also called editing, it uses a patient's own stem cells collected through a process called apheresis. Neither are universal cures. So bone marrow transplant, you need to find a match. So you might want to consider full siblings, even if they have the sickle cell trait, it's okay. Parents, or even an unrelated donor through a registry. With gene therapy, it uses a virus as an envelope to contain the genetic material. If a patient has prior exposure to that particular virus and has antibodies, they won't be eligible to receive that particular gene therapy. You can find out more about this through your local doctors, hospitals, in order to receive more information about this, depending on if you have the trait or not. So now we're going to get into a little bit more in depth about some caretaker procedures from our next guest speaker.
Hi, this is Priscilla Shiner, the counselor in the Pediatric Hematology Division at Rutgers Cancer Institute. As a counselor taking care of children with sickle cell disease and their families, I become involved from the first visit to the time that the child has become a young adult and is ready to transition to adult health care. Throughout that time, I'm there to provide support, counseling, and education regarding all of the non-medical issues that may arise. Initially, the focus is on the adjustment to having a baby with a lifelong illness. There is a sense of loss, what the parents envisioned and what they now face, fear of the unknown, anger that this has happened to their baby, and guilt. Through reassurance, support, education, and meeting other children and their families, these feelings most often subside. As our patients reach school age, I address school-related concerns and make sure that the school provides the necessary accommodations to that child. Adolescence is a difficult time to begin with, a time when kids want to be just like their peers. This is a time where we help that child to accept that sickle cell disease is just a small part of who they are. Empowering the adolescent to become responsible and knowledgeable about his or her own disease and medical care is an important part of becoming a successful adult who happens to be living with a chronic illness.
Hi everybody, my name is Nicole Bubb. I am the Chief Management Officer of Kanda Kavina and Executive Director. Thank you for joining us today for the Sickle Cell Awareness webinar. We're very excited to have you. So today we're just kind of gonna be going through my personal experience with sickle cell. But before I get into that, just a fun fact. In 1983, via the U.S. proclamation, is when Sickle Cell Awareness Month became Sickle Cell Awareness Month in September. So that's a little fun fact for all of you guys. Just to get started, just to like kind of review a little bit so I can explain my story to you guys. I'm just kind of going to go over like basic information needed for you to understand my personal story with dealing with sickle cell anemia. So sickle cell in itself is a gene mutation which stem from combating malaria. So the definition term of sickle cell is an inherited blood disorder where the red blood cells form an abnormal crescent or sickle shape. I always compare the shape to the Grim Reaper's sickle. So that's like what the shape of my cells look like. So an abnormal crescent or sickle shape at a low oxygen levels. The sickled cells block blood flow to small blood vessels, causing pain, and they have a shorter lifespan compared to normal red blood cells, which contribute to anemia. So just to kind of give you a backstory about, the lifespan of red blood cells in a normal person. In a normal person, the lifespan for red blood cells are 100 to 120 days. And when I say the lifespan for somebody who has sickle cell, you're going to be like, whoa. So the lifespan for my blood cells and anybody else that has sickle cell, the lifespan for blood cells is 10 to 20 days. From 100 to 120 to 10 to 20. So that's like a huge difference. So the fact that the lifespan of our cells aren't that long leaves a minimal amount of cells being able to deliver oxygen throughout the body. And that's when you start to get in trouble and you start to get a crisis, but I'll go into that more. So just to kind of explain different types of sickle cell, we have to talk about the genotype. So there's different kinds of genotypes. So a person that does not have sickle cell and just normal, everyday, regular schmegler Joe, their genotype would be AA, which means you're normal. Somebody who has sickle cell trait their genotype would be AS. And somebody who has sickle cell disease, their genotype would be SS, which is me. So the genotype SS is considered to be the most severe genotype of all of the sickle cell genotypes. Also, I forgot to mention, in SS there is the trait. AS there is the trait, and also there's another form of a trait called beta thalassemia. I apologize if I pronounce it wrong. I think I might have butchered it a little bit there, but it's that. It's around that phrasing. Some triggers of sickle cell is dehydration, stress, physical and emotional. On the physical side, if I go to the gym, overexert myself, push myself too hard, my body's gonna be like, oh heck no, and like I'll go into a crisis. And another end, emotional, is something like really bad or sad happened to my life that like it's like I'm boo-hoo crying all the time, and like my emotions are like all boiled up and all, you know, in myself, and I'm just not doing well. I can also put myself in a crisis. So that's the physical and emotional stress that can trigger a crisis. Another trigger is infections, so cold, flu, COVID. Those immunocompromised people, that's me. And weather and temperature changes are also triggers, as well as unhealthy habits such as drinking too much alcohol, such as smoking cigarettes, even eating bad food. I like McDonald's as much as the next person, but you can't have McDonald's every day. Maybe like, even myself, I like McDonald's, but I don't eat it that much, maybe once a month. And then as I'm getting older, I really don't care for McDonald's. Some health issues that stem from having sickle cell is stroke, pneumonia, avascular necrosis. Avascular necrosis is death of a bone, so which means like there's a minimal or lack of blood supply in a part of our body, because when you're in a crisis in a part of your body, the blood flow is not continuous like it should be. So if that keeps happening continuously, you can get avascular necrosis, which again is bone death. So for instance, my hip, I've been told that it's a possibility that avascular necrosis is in my shoulders and my hip, which means I've had crisis there too much, or lack of blood supply too much when I've had a crisis. So like my bones in my shoulders and my hips are like slowly dying. They're not there yet. I'm still very functional, but they do hurt. I always call myself, I'm 26. 26 going on 27, so I always joke with my nieces and nephews that I'm 86. I'm an old lady, because I might need some new hips soon. So there's that. There's also organ failure. There's gallstones, which happen in the gallbladder. There's vision loss, because like, and all these things just stem from lack of blood flow. So like when you have a blood disorder, hematology, which is like blood disorders, or not blood disorders, but blood, like a lot of issues can happen. Like if you don't have enough blood flow in a certain area of your body, the stuff is gonna start, shutting down. Vision loss. So like if the blood in the veins in the back of my eyes are not, going well, I could lose my vision. That's why it's important for people with sickle cell to like get their eyes checked, get like their lungs and their heart checked, get their brain scanned and checked all every few years, just to make sure everything is good. There's also leg ulcers that some sickle cell people can have. There's also jaundice. I'm not sure if everybody knows what jaundice is, but it's when your eyes are yellow. So jaundice happens for people with sickle cell usually when they're in crisis, and sometimes some of us just have it all throughout, like even if we're not in crisis, when we are in crisis. As I've gotten older, my jaundice has gone away, but when I was younger, it was like a lot. Like my eyes were yellow, and you could tell. Like I remember kids who used to walk up to me and be like, "Oh my God, why are your eyes yellow?" And I'd be super embarrassed, and like kind of like shy and timid, because I'm just like, "Oh my God, like I don't want people making fun of me." But to get rid of jaundice, it can be hard sometimes, but for the most, it's hard in the fact that you have to be like really continuous and constant. So like drinking lots of water and eating the right food is what helps get rid of jaundice. And then I think also my medication is what also helped me get rid of my yellow eyes. Sometimes I still do get it, but if I'm in like a really bad crisis, I'm in the hospital. Another thing that is a health issue is acute chest, which I'll get into a little bit later, and more stuff as well, but that's just like some of the most common ones. Now I'm going to go into types of crisis. So types of crisis is vaso-occlusive crisis, which is the generic everyday crisis that sickle cell people/patients have, and it occurs when sickle red blood cells slow or stop within the blood vessels. Another type of crisis is hemolytic crisis, which is a large number of red blood cells which are destroyed over a short period of time. A splenic secretion is a sickle red blood cells build up within the spleen, resulting in an enlarged spleen. Mind you, I've had all of these crises throughout my life, not at one time, sometimes at one time, sometimes just in one hospital visit. So like splenic secretion is a type of crisis. Like I had that back in 2018, and sometimes I sporadically have it, but in a very small level where I don't need to go to the hospital. So splenic secretion is essentially like your spleen is supposed to filter out your blood. So for sickle cell patients, sometimes the blood just builds up because the spleen is not filtering, and it gets enlarged and it becomes super painful. So sometimes so for a lot of sickle cell people, their spleen gets removed due to this. But when I had mine, thank God that they were able to treat it enough with like, pain medication and just monitoring it, and it went down itself. I always said that I would like to keep all the organs I was born with. And so if I can keep that promise to myself, great. If I can't, then it's okay. It is what it is. Another type of crisis is aplastic crisis, which is caused by parvovirus B19, where the bone marrow does not produce enough red blood cells. Another form of crisis is acute chest syndrome, which I mentioned earlier. So it's another form of a vaso-occlusive crisis that occurs within the lungs, which is caused by infection. So say I had pneumonia, I would get an acute chest, or I had a really bad cold, I could get an acute chest. Another form of a crisis is abdominal crisis and bone crisis, which is self-explanatory. Abdominal, the stomach, abdomen area, and in the bone you can have crisis as well. Bone crisis, they hurt the worst. I think I would say that, like, they hurt the worst. That's my personal opinion on that. And actually, I don't know, because now I'm thinking about my splenic secretion crisis, and that one was pretty harsh, because when your spleen starts to hurt, your collarbone also hurts. So like breathing, moving even a little, like me doing this, I couldn't do it. Like to take a deep breath, it hurt. So I think for me it would be between splenic secretion and bone crisis, which would be the most painful to deal with personally, because not being able to breathe or move even a little bit, or you'd literally be screaming. I had like at time, and like I have a very high pain tolerance. Like I'm a person that can stub my toe and just walk away without, cussing or screaming and like, ah! I was just like, okay, it happened. Now we walk off and go about our day. I told my sister this, and she's like, you're crazy. But it's just I just have a high pain tolerance. So for me to say something is painful, that's saying a lot. And to explain the pain of how sickle cell feels, I really can't explain it to you. That's how painful it is. Like, imagine the worst pain you've ever had in your whole entire life and times it by 100. Imagine like somebody being inside your bones, or even in your muscles, and they're like just in there just knocking on everything, like they're playing like drums, like they're in a rock band, or like they're taking a bunch of needles and just like stabbing you, or taking a knife and stuff. Like literally the worst possible thing you can think of is how the pain for sickle cell people feels like. Sometimes people who have the trait, they also get into crisis. Sometimes it could be a smaller crisis compared to a sickle cell disease, or it can be the exact same thing. Every sickle cell patient is different. So kind of giving you guys a little review about what sickle cell is. I'm kind of going into my story now. So just to kind of go back to refresh about the genotype, just to talk about my parents. So my parents, my mom is from Ghana, which is in Africa, and my dad's from Grenada, which is a Caribbean island. So they're both from, foreign countries, areas. They're not from America, but they are citizens here. So they are unaware of what sickle cell is. They never heard about sickle cell until I was born. So at the moment that I was born, they were told that I have sickle cell. To come to find out, they both have the trait. And like I said before, a genotype for the trait is AS. So when you're somebody who has the trait and you marry somebody who has a trait, the children that you can make is either AA, normal, AS, another person with a trait, or SS, me, which I get the whole sickle cell disease. So they made me, I got SS. My brother, he's AA. He's a normal, regular, schmegular Joe. And my sisters, they're all fine. So it was me that got it, which is perfectly okay, because everything happens for a reason, as I like to say, and all of our journeys are different and our destinies are different. So that's how I was created, due to my parents having the trait. And I actually think my mom has beta thalassemia. I'm sorry if I'm butchering his name. I've always had struggle with pronouncing it. So kind of explaining how I came about. My experience with sickle cell, my first crisis was actually at 5. So from the minute I was born until 5 years old, I was fine. And I literally vividly remember how I had that crisis. So it was a nice hot summer day. My parents had bought me like a little kiddie pool that they put in the backyard. They got the hose, they got the cold water going. Me and one of my cousins were playing in the pool, and we were just like, just having a grand old time. I didn't want to get out. I love water. So I was playing in the pool, and then when your parents and your mom comes out, and she's like, yeah, it's time for y'all to get out. You gotta go to a shower and all this other stuff. And you're like, oh man. So she got dried off, went upstairs, showered, did all the nightly routine type stuff, and then sleep came, and then me waking up, everybody, including myself, screaming bloody murder. Like parents would think, they took me to the hospital. So they took me to the hospital. Come to find out, I'm having a crisis, and that was the beginning of my sickle cell journey. And ever since then, at least through my childhood, I was in the hospital minimum 2 to 3 times a year, at minimum. And when I was younger, I'd stay a week or 2. I think the maximum I've ever been in the hospital as a kid was a month. So I was always in and out. I remember being in the ICU because like my pain got really bad. My hemoglobin was like dropped really low. I've had a lot of near-death experience as a child. As I've gotten older, when I went to college, from my freshman year, I did go to the hospital my first and second semester, but from sophomore to senior year, I was fine. No hospitalizations. It was the first time in my life I've never ever went to the hospital, and I was shook because I was just like, what is this? But something I do remember that I didn't realize until much later, I was popping Motrin left and right. So I was still having sickle cell crisis, but very minimal, where Motrin could take care of it, which is good in a sense, because it could be much worse, but also I don't know how much Motrin I took. I just remember, like, I was taking Motrin because I would be in pain sometimes, like my back or something would hurt. But I didn't need anything past Motrin because it would help. Motrin ibuprofen is what it's the actual term is called, but when I say Motrin, I'm talking about the brand name. But ibuprofen is actually the terminology for it. So come after college, I graduated, I started working. That's 2017. 2018 comes, February, end of February hits, beginning of March. Boom, hospital. Crisis is off the charts. Like, I'm talking about, I don't forgot what a crisis feels like. I was in a lot of pain. I was just like, what is going on with me? Am I dying? I was. I can be very cynical, and like somebody listening to this is probably being like, why is she laughing and joking? Honestly, it's my life. I mean, I go through it on a daily basis, so it's something that's second nature to me, and it's how I'm living. I can't like be like depressed or anything about it. I mean, I have been depressed or anxious about something sometimes when I'm in a crisis, but overall, this is my personality. So I'm kind of like more of on the positive side. It happened, you move on. So anyway, to like kind of get into 2018, something called hemoglobin. Normal people's hemoglobin is like, I would say 12 or higher. The highest I've ever seen mine is 10, and that's due to the medication I take. But like usually my baseline with the medication I take is at 9. Before I started taking this medication, my baseline was 7, 8, 6 on like a rough type day. But hemoglobin is you need your levels to be up. So mine dropped to 3 or 4. And again, sickle cell is a blood disorder, and lack of oxygen is going throughout my body. So imagine your hemoglobin dropping to like 3. There was this resident that was, practicing to become a full-blown doctor. She was sweet. I remember her very vividly. I loved her. She was like one of my favorite residents. And like she worked with me because at that point I was in the hospital for months, so for at least 2 months before I was able to go home. So she came in, and she would come in, and like at that point, like it was getting real bad with my crisis. It wasn't being hit, like the pain medicine wasn't working for me. She would walk in, and she's a resident, mind you, she's a resident. She has not mastered the art of the poker face. So all you could read her face. Anybody, a 5-year-old could read her face. Like she wanted to cry anytime she looked at me. Her face just said, "You're dying, and we don't know what the heck to do." So I was just like sitting in the bed, half conscious, being like, great. So let's try to figure this out, because I could feel myself circling the drain. And at that point, I was really in and out of consciousness. I just remember being in and out of consciousness. Like sometimes I'll be sleeping, sometimes I'll wake, sometimes I remember people coming to visit me, and I would say hi. I would be in the conversation for like maybe 10-15 minutes tops, be knocked out. Again, I was also on like very strong pain medication, which is narcotics. So I wasn't sleeping and I wasn't feeling good. So if you're in a lot of pain, like your automatic go-to is, falling asleep. So like I think as I'm older, I think my experience in that form, I think is more memorable to me compared to when I was a child, because like I vividly remember like everything that was going on, even though I was in and out of consciousness. And from 2018 to like now, I've been in and out the hospital consistently. Like me sitting here talking to you right now, you wouldn't think I'm in pain, but I'm in a lot of pain. But like it's something I'm used to. It'd be like if I came to you and pinched you every day for a year, even 2, and you would get used to a little pinch until I like go into you like really, really hard. That's when you're gonna start feeling it. So the going into you really hard is the crisis part, but me pinching you, That's like, the everyday type of pain that I feel and I can function. Some days I have my good days and some days I have my bad days. Like today's a good day. My pain is managed and controlled. I can come on here and talk to you. Some days, like, I'm overly tired. I can't move or can't function. I just need to like lay in bed. And sometimes I berate myself for being tired even. I'm starting to learn and be better at that. But I'm just like, oh, you're so lazy. But in the grand scheme of things, I'm nowhere near lazy. I'm dealing with a genetic disorder that I've dealt with since the day I came into this world. So it's important for me to remind myself that it's okay if you need to have days where like you just need to relax. And I'm not somebody that knows how to relax. I'm teaching myself. And I promise you, everybody in my life, especially my friends, they yell at me, especially my sisters, they yell at me to sit my butt down. I'm just like a go person. I like being busy. But anyway, to kind of continue into my story, so in 2018, I was kind of like in the hospital for a month or two, and then like, excuse me, I would leave maybe a week, maybe 3 days. I was back in. Then I would stay for like another 2-3 weeks, and then I would continue. I think like in 2018, I got a break in May. I was out for like a week. I went back to work because I was feeling better. Literally, after the next day of working, I was back in the hospital, and I had to text my boss that I'm back in here. And at that time, I was working in the city. Like, I had an amazing HR assistant job. When I was working in the city, I had an amazing HR assistant job. I went to the hospital for another 2-3 weeks. I think I got a break for a month. And at that point, I was literally fed up with being in the hospital. So I booked a vacation to Mexico. Was it like sporadic and like impulsive? Definitely. But I was just like, I almost died. I'm tired of being in the hospital. I need to see a new environment. I'm just tired of being here. So my friend went to Mexico with me, and I had an amazing time. And I felt like happy and like free, and like I didn't feel like I was in pain. I didn't feel like I needed medication. We came back, I was fine for like weeks. I think for like another month I was good. I was doing better, I was healthy, and then bam, back in the hospital for another couple weeks. And then the cycle kind of continued from 2018 to now. Like last year I was in the hospital for like 2-3 months straight. So this year I've only been into the ER, haven't really been to the hospital, but I've also been battling crisis, but more so trying to control it at home because I try my best to stay at the hospital because I don't like going to the hospital. And also, not all of my experiences in the hospital have been great either. Some medical professions are unaware of what sickle cell is actually, and some of them are aware and know very basic and minimum information about sickle cell and are very judgmental of sickle cell patients. And some of them are very much aware, and the ones that are very much aware, I love them. My heart goes out to them. They're phenomenal and they're amazing, and they've helped me through a lot. But at the end of the day, medical professionals are people, and people can be either bad, good, depending on the day. So those ones, they're a little traumatizing, not gonna lie. There was like discrimination, judgments over there, prejudiceness. Like I can like just list a name. Like I remember one time a doctor came to me and was just like, "Oh, you're just here for pain medication. You're an addict." Huh? Excuse me? And that hurt. It did a lot. Because like you can kind of get a basis of my personality. Addiction does not run in my family. From the minute I started going to the hospital, my parents taught me, if you don't need the medicine, don't take it. I've gotten yelled at by doctors, my personal doctors, to be like, look, Nicole, you're gonna have to take this dang medicine so you can get better. And my hard-headed self be like, I think I can handle the pain for now. And then I can handle the pain. It's not the fact that I can't handle the pain, it's the fact that if I keep letting the pain get to the point that it keeps getting to, then that's what equates for me jumping from this to being screaming bloody murder in the hospital because I'm in so much pain. So if I can control the pain then and there, I don't have to go to the hospital. So over the years I've learned that. So when I do encounter some doctors and nurses or any type of medical professionals that like just judge me off the get-go, it does hurt, but I'm like, I know my story, it's okay, and I know how to advocate and defend myself. It hasn't always been great in hospitals. That's why we're having this awareness webinar, because I think it's imperative that people are super aware of what sickle cell anemia / disease is, because it's not talked about enough. And when sickle cell patients go into the hospital, they're looking for help. They're not looking for you to point fingers at them and call them an addict. If somebody needs morphine or Dilaudid to deal with the pain, that's what they need. If there was a better treatment plan in place for sickle cell patients, they would not be pressed to have the pain medication. Is what we need to deal with our pain, unfortunately, and that's the treatment plan they came up with. But if they want us not to be taking all these strong narcotics to deal with the pain, funding and awareness needs to happen so that people are more aware of what sickle cell is, and funding can go into sickle cell research so they can come up with a cure. There are certain treatments that are pretty risky. They're not cures, but they're kind of risky. They're the bone marrow transplant. There's blood transfusions, which is on the lower side. There's blood exchanges. There's different types of medication that has come about in the recent years that is another treatment plan to negate people getting into crisis and to like control crisis at the baseline level, which is the blood cell and the hemoglobin and hemolysis and all the other stuff. So like experiences in the hospital, I've had good ones, I've had bad ones. It depends, and it depends due to the people I encounter. Just to also go back to talking about blood transfusions, I'm somebody that can't get blood transfusions anymore because I've gotten it so much from 5 years old till now that I'm unable to get it due to having antibodies. So since I have antibodies, unless like I kind of more or less in a life or death situation, that's the only time I can get a blood transfusion, because it's very hard to find a match for me due to my antibodies, because my body was like, yeah, no, we don't want this anymore, essentially. So since my body said that, another alternative is doing steroids, a form of steroids. There's different types of steroids out there, guys. So this one is to help my hemoglobin rise up. But that has risk in itself, because either it can make me better or it can put me in a crisis. And when I tell you, and I've had a bad crisis from taking those, it was horrendous. Like, the pain was out of this world. Like, it can really induce a crisis if you're not careful. So that is like, it's risky. So like the treatment plans, they all have some form of risk. There's no like definitive cure. So awareness needs to be made for sickle cell, and this is our part as Candy Kavina to make it more broadly broadcasted with the platform that we've been given. Just to kind of go into like do's and don'ts for sickle cell patients, and like reminders, I am going to explain some of those stuff to you. So some of the things that you should be aware of is that sickle cell patients, people, they don't look like they're in pain all the time. Like right now, I told you guys that I am in pain. I don't look like I'm in pain. I'm laughing, I'm joking with you. And sometimes this is how I am in the ER when I'm having like a full-blown crisis and all I want to do is crumble in a ball and start bawling crying. But my coping mechanism is to laugh, is to joke with the medical professionals, for them to tell me stories. It's just how I cope. That's how I deal with my pain. Because if I concentrate on the pain, it's not going to be good for my mental. Sickle cell patients, sickle cell is considered an invisible disease, but there's nothing invisible about it. But you should very much be aware that we don't look like we're in pain. Not always. We're very good at masking it. I always say that sickle cell patients are excellent actors and actresses because we can go about our day as any normal person, but also internally we are screaming out of our minds because we're in pain and we just want to crumble. So that's something you should be very much aware of. We are strong. People tell me I'm strong. I say, but when I look at other sickle cell patients, I see the strength in them because of what they go through every day, and I see what people see in me when they say I'm strong. Our pain can be constant. We can be normal in 1 second, and another split second, we can be in pain the next, crying bloody murder and needing to go to the hospital. It's instantaneous how the pain can switch up on us. We have no control over our own bodies. And also, pain can start in my back, and in like 2 minutes it can be in my shoulders, and in another 2 minutes it can be in my shoulders and my back and my knees. So it can jump all over, it can switch places. Like, it's very unpredictable. We get very fatigued, very tired, which contributes to the lifespan of our blood cells. It's very minimal, 10 to 20 days compared to 100 to 120 days. We're very tired, we're fatigued. But we try to push through it. And sickle cell overall affects different sickle cell patients differently. Like, I have my experience, but somebody else who has sickle cell trait or sickle cell disease has their experience. And then some don'ts. Personally, for me, it might be different for somebody else. When somebody tells you they have sickle cell, don't apologize. What are you apologizing for? They've had it their whole life. They've dealt with it. There's no apology needed. It's always been kind of weird for me when people say, "Oh, I'm sorry." I'm just like, I really don't know what to do with that. Just be like, I'd rather you be like, "Oh, really?" Like, I'd rather you ask me like what sickle cell is and explain it to you, and so you become more knowledgeable about it. Again, awareness. Another thing, don't recommend treatment to sickle cell patients unless you're a medical professional, because I promise you, most sickle cell patients / people, they looked up everything in the book to try to do with their sickle cell, to try to get rid of their sickle cell. Nobody wants to be in pain every day of their life and not have any control of their body. So just be careful when you're like, "Oh, did you try this? Did you try that?" And if you do want to recommend them something, be like, "Oh, I'm not sure if you're aware of this or not, but I just wanted to share this with you just in case." That's fine, but just don't be like, "Oh, like kind of like an attacking type of way." That's a little bit too much. And I'm pretty sure their own doctors and nurses have already talked to them about the different treatment plans that are out there, different experimental things that are going on at the moment. So I'm pretty sure they're aware, but it's also how you approach the situation as well. And if you know somebody who has sickle cell or ever meet somebody that has sickle cell, the best thing you could do for them is learn about what sickle cell is, because that, more than anything, shows you care. Like, you took the time out to learn about something that I've been dealing with my whole life. That means a whole lot, I promise you. Like, some of my friends have done it for me, and I love you guys. That's all I can say. Like, I appreciate you guys going out of your way to learn more about me, internally and externally. We also are not fragile. Yes, we are in pain. Yes, we can do different stuff like a regular Joe. We just have to have a good balance of things we do. So don't treat us like we're about to break. We don't like that. I shouldn't talk for everybody, but most of us don't like that. We also deal with a lot internally and externally. So, just be there for us. We appreciate you being there and being our support system and, just joking and laughing with us. When I always say, like, my best form of medicine is when people come and visit me in the hospital and we're just talking and joking and laughing. If I had people visit me for 5 days straight, I promise you I'm going to be out of the hospital by the weekend if I laugh every single day. Because every time somebody visits me, it brings up my spirits, it brings up my energy. I'm laughing, something I love to do, and it just helps me feel better overall. So simple things like that, and do a lot. Even if you can't visit them, FaceTime them, call them, text them. Just stay here thinking about them. It means a lot. Even if they're not in the hospital, even if you just check on them, like, oh hey, how you doing today? Do you want to hang out? Do you need anything? That goes a long way. Don't be afraid of them because they have sickle cell. Because some people like to tiptoe around people that have like a disease, and I'm just like, I'm a normal person. I just have a disease, so I don't understand what the tiptoeing is about. So just, don't be afraid, and also don't use it against them. That's not cool at all, because some people, like I said, people are people. We have good, bad, and okay. Some people will use that you have a disease against you, like, oh, you're like this because you have sickle cell, or oh, that's why you have sickle cell. Like that's messed up. Like, even if, let's say, like, you had a significant other that used it against you, that would be really messed up. So don't use it against them. So that's the end of my personal story and explaining a bit about what sickle cell is. I hope you have enjoyed this webinar. It has been super informal for you. I hope that you share it with other people, because it's on Facebook and YouTube, so y'all can share it now. And more awareness for sickle cell starts to come about, because it's really important for people to be knowledgeable and aware about sickle cell. And Mrs. CEO, as I call her, Ms. Kavina Miller over here, who is the CEO of Candy Kavina, she's the one that actually said, let's do this. I didn't bring it up. I didn't say anything about it. She brought it to me and said, like, let's do the sickle cell webinar. And I am super appreciative that she said something and that she said she wanted to do this. That in itself means a lot. I'm over here gonna get a little emotional. So that means a lot. I hope you guys have enjoyed this. Again, I hope you guys have an amazing day, and be your best self. Always be your best self, and support Candy Kavina. Come to us for any business services you may need. Tell everybody about it. Candy Kavina. Buy our hoodies, buy our shirts, buy our tumblers. It's on our website, candykavina.com/shop, candykavina.com, period. That's it. Go on our website and see what we're about. And I definitely hope you've enjoyed our webinar and learned a lot. Thank you. We appreciate you guys for tuning in. Much love. Bye.
So we just like to give a big thank you for coming to this webinar. It was a huge accomplishment. We are so proud of everyone that was involved, everyone who shared to bring awareness. A big thank you to our guest speakers, Dr. Richard Drachman and Ms. Priscilla Schneider, for giving their time and resources and explaining what sickle cell is and treatments that are available to patients and other resources for sickle cell families, and their roles play a huge part in how we're able to bring more and more awareness to the community about sickle cell disease. We also want to thank Nikki for giving her time and her energy and her life experiences and everything that she's gone through, and just bringing more awareness about this very, very serious disease to light. So Nikki would just like to thank God, her family, and her friends for being her support system. Nikki will also like to thank all of the medical professionals that have helped her through the years and dealing with sickle cell, and also the nurses and doctors that she is unaware of who also helped her out and took care of sickle cell patients. On behalf of Ken and Kavina, myself, Nikki, our team, we would like to just give a heartwarming and biggest thank you to everyone who came on tonight to watch this webinar and anyone who watches it afterwards. So please be sure to share this video with any and everyone to bring more awareness for sickle cell anemia. Thank you. Stay safe. Good night, everyone.